Medical experts have given the reassurance that the risk of having heart inflammation after a second mRNA COVID-19 jab is very small. Now, this echoes what Singapore's expert committee on COVID-19 vaccination had earlier said about myocarditis and pericarditis. Now, Singapore has reported 6 such cases as of last Monday, and all have recovered or been discharged from hospital. In a joint statement, the chapter of Cardiologists, College of Physicians, the Academy of Medicine and the Singapore Cardiac Society continue to recommend that the public get vaccinated. They say that the jabs will prevent most people from getting seriously ill from the coronavirus. And for a closer look, we're joined by Associate Professor Yeo Kung Keong. He's chair of the chapter of cardiologists at the College of Physicians Singapore and the Academy of Medicine. Good evening, Professor Yeo. What sample size, first of all, here in Singapore would we need for more conclusive findings?
Good evening. Thanks for the question. This is a difficult question to answer because really we don't know what the true incidence of this problem is. And in Singapore, as you saw, the numbers are very small. What we are going to rely on is actually data from overseas. And I think the data that the FDA in the United States would be instructive. Just to put things into perspective, the additional risk that we are talking about for this myocarditis or pericarditis is estimated at 1.6 cases per 100,000 doses of vaccine. That, given the number of young people that we are vaccinating, really means that it would take a lot of cases before we can tell. So rather than look at our local data, I think it is probably much more important to keep track of what's being reported in countries like the United States.
Professor, myocarditis and pericarditis, they're both serious inflammatory conditions of the heart. And I understand that from anywhere from 2 to 11 in 100,000 people get it each year. So how would this affect the occurrence then among those who get vaccinated, especially with their second jab?
Thanks for that question. So what we are looking at is the incidence of this condition over a period of time, and the annual rates which you just looked at reported 2 to 11 per 100,000 persons per year. Means that if over a period of time we have a lot more of such cases, we could calculate the impact of myocarditis or pericarditis related to the vaccination. Of course, we could do somewhat more complicated calculations to estimate those rates during the period of time in the immediate period after vaccination. But right now, the signals are really small, as you saw, only 6 so far.
Well, Professor, only one of the six vaccination-related cases here in Singapore was a woman. 4 were young men. Explain to us, if you will, why the marked difference in gender and age.
That's a really good question. We don't really know. We do know, for example, that the prevalence, or rather the incidence of myocarditis is more common in males. And if from our local data, it does appear to be more common in the younger people, but it also can hit older folks. But I would say that current precautions advised by the government makes sense based on what's being reported out of the United States. In that particular set of data, it appears to affect those younger than age 30 and largely in the male gender. So we're going to follow those advice. And that, I think, would be important for us to guide our treatment and monitoring. I think this whole arena continues to be rapidly evolving, and all of us in the medical community are keeping a close look at this data coming out from the United States and other regions.
Professor, if the risks are low, as you've sort of described, why are cardiologists bringing these 2 conditions to the public's attention now?
Well, I think it's not so much that we desire to bring it to the public attention for its own sake, but I think many of us are worried about the heart. And when the FDA, when the Israelis shared their findings, through the social media networks, we noticed a spike in concern in this area. And I think in such a situation, it's important to state up front what we understand of the condition, share transparently what we know, so that we can allay public concerns. And I think we must remember that at the end of the day, what we want to achieve is to defeat this pandemic and to keep it under control. And the vaccination program is a critical part of this. So we want to make sure that we share whatever knowledge and understanding we have with our fellow Singaporeans and residents as much as possible. So this is going to be important to all of us here.
Well, Professor, you've alluded to the fact that this sphere of knowledge is rapidly evolving. So what further studies are being done right now? There are several reports coming out from the US, the UK, and Israel. I understand that the Centers for Diseases Control in the US is having a meeting on the 18th of this month, and we hope to hear more about their more detailed analysis of the association between myocarditis and vaccination. We also understand that Israel and the UK are analyzing their data, and hopefully they will be able to share more with the rest of the world. In the meantime, within Singapore, I think our clinical community, our doctors have been alerted to this possibility and are keeping a close eye and will report any adverse reactions to the HSA. So I think there's going to be lots of information coming out over the next few weeks, I believe.
Well, thank you for keeping a close eye on it for us as well. Clinical Associate Professor Yeo Koon Keong.